Hey everybody, my name is Dana Grady and I'm an occupational therapist for the Anniston and Gadsden CRS offices. So today we're going to get to show you how we are allowing 2 of our young girls to be independent in their feeding today by using the Obi Independent Feeder, which is a robotic feeder. Our first client's name is Alexis. She is a young woman, highly intelligent. She's actually wanting to study to be an aerospace engineer starting next fall. So you can imagine how highly intelligent she is. She's the perfect candidate for this device. Alexis has arthrogryposis, so she has limited motor movements in her upper extremities. We brought her in and she just immediately knew how to do this, no problems at all. She immediately qualified for it, and you will see that today how well she does with it. So earlier I said Alexis wanted to be an aerospace engineer because that's what she's told me the past year, but what do you want to do now?
I've actually changed it. I wanted to go into psychology. That sounds like 2 completely different fields, but the whole reason why I wanted to do aerospace engineering in the first place was so that way I could help people and help advance society, and it's just really at the end of the day the 2 causes or the 2 roots for why I want to do it is from the same cause.
Alright guys, so the first thing I'm going to do is attach this spoon to our Obi Robotic Feeder or Obi Independent Feeder, and it's just going to go into a neutral position here. Pushing the power button, and it's going to bow for us, okay? It's going to bow and tell us it's ready to work. Okay? So I'm going to push this teach mode so it knows that we're ready. And I'm going to grab this teach button up here and bring it to Alexis's mouth. And then we're going to go back down. Okay? There's 2 switches here. The first switch is going to move the spoon to whatever food group she's wanting to eat. There's 4 choices, 4 different bowls that she can choose from. And then our second switch is actually going to bring the spoon to her mouth. And then when she hits it again, it will go back to the bowls. Okay? So you got to hit it 3 times. Good. Right. See how it's scraping the side of the bowl and cleaning the spoon for you? Good. All right, send it back. Let's try to get that cheese again. There we go. Good. Okay, send it back and you can get what you want next. That spoon's perfect for her. We don't want it going all the way to her throat, to her mouth. We want her to be able to lean up a little bit and get it. All right, now we're having some beef jerky. Good. Now, you can send it back, and if she needs a rest break to chew and get everything down, you know, she can just sit here and let it rest for a minute. If you go so long without eating too, the Obi will go back to its station and dump the food. So and that's saying, okay, they must not want to bite now, so let me go back and empty the spoon. Then all we're going to do is push the power button after our meal, and it's going to go back to a neutral position and go to sleep.
Mom has been following the OB development on Instagram for a while, so whenever we got the call saying, do you want to check it out, we were like, heck yeah!
So since moving to Alabama, it's changed a lot of things. My husband's in the military, we moved state to state, and with each state I usually have to start over, finding connections, you know, vendors, things like that, and I do it myself. We moved to Alabama, they're like, go to CRS, they'll help you. And they usually, when we go to places, they just say, these are the people you need to talk to. CRS has said, this is what we're going to do for you.
Mariana is our second teenager coming in today. She was born with multiple limb deficiencies, and she's interesting because she has a lower left extremity that's kind of functional, and she was actually using that to feed herself. She wants to use it at school and home. We have a mount for her with the switches on it so she can actually access this device with her left lower extremity, and you'll get to see that today. So she's going to be demoing the Obi Independent Feeder today. She actually came through our feeding clinic and qualified for one because she did awesome. Okay, so what I'm going to do, I'm going to hit this teach button, okay? And then I'm going to bring it right to your mouth, about right there. And then I'm going to hit this teach button again. So now it's calibrated to go straight to her mouth so she doesn't have to do so much work, okay? Now switch it to whichever food that you want next. Okay, so she switched it to the blueberries, and go ahead and take a bite for us. And you shouldn't have to lean too far forward, okay? That's a huge bite. You do not have to eat all that. Okay. And go ahead and take it back. Good. Let's try some yogurt this time. Yep, that's right. Good. Good. The Obi comes with 2 sizes of spoons. It looks like I gave her the deep one that gives her the most food, okay? All right, take it back. Okay, and try some cheese. Perfect. See how it scrapes the food off the side too? Good. All right, let's try that beef jerky again. And that's one trick I've noticed. Miss Franklin is trying to move it to the front a little bit. There we go. Yeah. Now it's got a huge, all right.
Well, none are.
Now your protein's coming. Okay, try the blueberries again. Again, Mariana is the perfect candidate for this because her cognition is amazing. She's super smart. She has the motivation to be independent, which is very important for a robotic device like this. And she has no swallowing issues, no reason for this to be a safety hazard, okay? Okay, so Mariana, was it you and I that tried water in this last time? It may have been me and Alexis. We put water in it and it did just fine. So
you just have to pour it into the little
in theory, you could do liquids, milkshakes, ice cream, all that. And one thing I look at when I'm seeing my patients and my clients, I'm looking at them and I'm saying, how can I make their lives better, their lives more meaningful in their daily occupations? How can I make them independent in their activities of daily living?